one of the options that's become more in vogue is ankle replacement. In the 70s and 80s, in early 80s, people were doing investigations on ankle replacement, and I would tell you across the board, the results were dismal. There were horrible failures. The implants would fail at a year, 2 years, and people generally did poor. And then there's this long period where one author whose lecture I watched talked about it being this nuclear winter where nothing happened. And then in the early 90s, they started investigating second generation implants, which had more promise. Now we're on to the third and fourth generation. This is an example of a modern day implant. This is the Scandinavian total ankle replacement, or the STAR. And basically what they're doing here is you resurface the end of the tibia with a metal plate, you resurface the top of the talus with this rounded implant, and then there's a mobile plastic spacer in between that allows some motion to take place. This is what it looks like in place. This is a STAR. And again, there's the tibial plate on top, the talar component on the bottom, and then that black space in between that you see on the right. That's where the polyethylene or plastic spacer sits. When we talk to patients, we'll compare and contrast what you can expect from one treatment versus the other. So when we talk about motion, you'll preserve some motion with an arthroplasty, whereas you'll lose it with an ankle. Both are very, very good as far as pain relief. They both work really, really pretty well. With an arthroplasty, they're weight bearing on it 3 to 6 weeks, whereas with an ankle fusion, it might be about three months or so. One of the things that's nice about ankle arthrodesis, however, is their durability. Once an ankle arthrodesis takes, it lasts. Those patients disappear, you don't see them anymore, because they do pretty well. Ankle arthroplasty patients, because of questions about long-term durability, you'll see those people over and over in the future. When you look at the gait analysis of people who've had replacement arthrodesis, it's remarkable how similar they are. The people with replace aren't that much better. But people are generally pretty happy because their pain is better, and that's what makes them walk better. But somebody mentioned, nobody gets normal motion back. If patients come to me saying, I want a normal ankle again, we kind of have to disabuse them of that notion. God made you perfect. Lori hears me tell this to patients all the time. God made you perfect the first time. None of us are that good. So what I look at is their age and their expected activity level. The question with arthroplasty is how durable they are. And even with some of the newer generations, they're more durable than they used to be. But do I necessarily feel confident putting it in a really active 15-year-old with arthritis? No way. Not a chance. So I look at their activity level. If I have somebody who's relatively young, 50, 60, who's still pretty active, they don't get a arthroplasty. They'll get a fusion. And I know that's something that's going to last a long time, go do well. There's some studies being done about converting fusions to arthroplasty, really early stuff still. That's a possibility for them, but in the near term, it's a poor idea, because what happens is when these things loosen, there's a lot of mobility, there's a lot of motion there, a lot of the bone gets ground down, and suddenly you have a loose implant, and there's no bone to work with, and now you're really in a pickle. So that's why younger patients don't get it. If I have somebody who's 70, relatively sedentary, they get choices. I don't sell them. I want to. I really will let them pick because I think they're really, really appropriate options for them. So these are reasonable lives. You tell most told they can walk, hike, travel. They can bowl. I think they can do doubles tennis. Jumping activities are out. Skiing is out. Marathoning and things like that. So it's low impact activities. They can still swim, they can do elliptical and things like that. They can go on walks, but days of 5Ks. It's the bike. So we are again, a lot of this goes into explaining to patients ahead of time so they know what's realistic.